I wasn't a candidate for regular LASIK surgery, which is where they apparently will cut, a flap in the cornea, pull the cornea back. My cornea was too thin to have the standard surgery, so I became a candidate for Epi-LASIK surgery. Now, the decision to have the surgery at all was driven by a couple of things. One, just the inconvenience of wearing prescription eyewear, and I did not want to wear contacts. Plus the fact that I'm kind of an outdoors person and a water sports person, so I water ski and windsurf, and in as much as I was very active in those kinds of activities, I just couldn't have a full enjoyment with them because I would do them without glasses because I didn't want to wear sunglasses because of all the water and splashing, and so I finally had a point. It just came to the point where I said, well, I think I want to do something about this so I can just, enjoy these activities without having to wear prescription eyewear. I had my surgery at EyeHealth because my wife had her surgery here. So that was why. And couldn't have been a better recommendation. My wife had a very positive experience, and so I came and consulted here first. They measured my eyes several times to ensure that, first of all, I was a candidate for the surgery and what kind of surgery I would have. Also, just to make sure that the readings that they were collecting were accurate. The staff went to great lengths to tell me exactly how the procedure was performed, over what time frame it would take to, accomplish the procedure, and what my recovery would be like. There was extensive education as to the type of risks that would be I would be taking with this type of procedure. So I found it to be very thorough and very informative. My experience the day of the surgery was one I'll never forget. But the preparation was with some eye drops to kind of, I guess you could say, maybe anesthetize my eyes, but one of the things that Dr. Hagen performed was, we had to, again, kind of visually inspect my eye and actually make some markings on it, I guess. And but of course, at that time, he'd made enough exams that I was kind of comfortable with what he was doing. The next step was to go into the operating room, I guess you could say, where they have the instrument that performed the LASIK surgery, where you're reclined on your back, and they again take more readings of your eyes from the machinery, and then they will apply like some tape and some things to your face to kind of make sure you don't blink during the procedure, and kind of hold your head in place. And so, once they start the procedure, there's not a whole lot you can see. You can in fact, one of the things that you will actually not see anything, because in the case of Epi-LASIK, which might be with other surgeries, I'm not sure, they are going to peel back a layer of the epithelium on your cornea, and that is done by a device that essentially kind of did like a little tiny cut, like I think they call it like a keratometer, which just does an incredibly thin slice, just to slice the epithelium, and they will pull that back. And then there are like three laser blasts or laser applications to the eye to adjust the eye to it. And I don't know, can't describe other than there was some rather fantastic colors that occurred during the surgery. During the procedure, both Dr. Hagen and the staff were, giving me constant instructions on what to do. So basically, you're just going to stay there motionless and not do anything. But the surgery is quick. Couldn't have been more than 10 or 15 minutes once, maybe even less than that when they did it. And I think my entire time in the surgery center was less than an hour. I experienced no pain at all. There was some discomfort post-surgical that lasted for at least several days, and again, this was explained to me and was not a problem, but other than, yes, it was discomfort, uncomfortable. It was like, your eyes were scratchy and you just had plenty of eye drops to take while recovering. My vision before the surgery was probably about 20/50, 2100 approximately a 1.5 minus 1.5 correction. And post-surgery, with both eyes, I have pretty much 20/15 vision. So I've never had better vision in my life than, well, except for maybe when I was very young. It's quite liberating, the fact that I just do not have to wear prescription eyewear for any sporting activities or any outdoor activities where I use my distance vision. One thing that I did give up, which I was well aware of, is that pre-surgery I didn't need reading glasses, so I had great reading ability and close-up ability, but I gave that up and I now wear readers, but again, I just love not having to wear prescription eyewear of any kind.